ಸರ್ ಸ್ಟಾರ್ಟ್ ಮಾಡೋಣವಾ?
ಒಂದು 5 ನಿಮಿಷ, ಇನ್ನೊಂದು 2 ನಿಮಿಷ ತಡ್ರಿ. ಇದಕ್ಕೆ ಸ್ಟಾರ್ಟ್ ಮಾಡಬಹುದು.
With the blessings of our master, Dr. Christian Frederick Samuel Hahnemann, we would like, with the blessings of our master, Dr. Christian Frederick Samuel Hahnemann, we would like to start this program. Namaste. I would like to welcome you all to the seminar on homeopathic Materia Medica. The topic of today's session is how to write Materia Medica answers in university exams and method to study homeopathic therapeutics. First, I would like to introduce you all about Jignasa. Jignasa is a pan-India movement initiated by Akhil Bharatiya Vidyarthi Parishad to provide a common platform to address all aspects related to Ayush system, Ayurveda, Yoga, Unani, Siddha, Sovaripa, and homeopathy. Jignasa works with a mission of learn Ayush to practice Ayush and with a vision of empowering Ayush students from campus to community, becoming a bridge between Ayush students and policymakers as well as administrative authorities, connecting every aspects of Ayush, including students, academicians, practitioners, scientists, industries, and hospitals under one umbrella, think globally and act globally. Now, I would like to welcome Naveen Hugar to introduce Sir to the session.
Good evening, everyone. I'm here to introduce you to our today's speaker, Dr. Anand J. HOSUR, sir. Sir has completed his BHMS in AM Sheikh Medical College in 1999 from Karnataka University and MD in Materia Medica in 2004 from Bharatesh Homoeopathic Medical College. Sir has 15 years of teaching experience. Sir has been ex-principal, professor, and HOD in Shiv Basav Jyoti Homeopathic Medical College and has been principal for Jain Homeopathic Medical College and a former syndicate member of Rani Chennamma University, Belagavi, and has been qualified twice for personality test interview for KAS exams. Sir has been an academic council member 2018 to 19 in RGHS, and Sir has been examiner and question paper setter for various universities across the country. Sir has been a master trainer in RGHS workshop on assessment methods. He has published various papers and presentation in various conferences. Sir has been certified as an assessor for Ayush by NABH. Sir is currently a professor and PG guide at Bharatesh Homeopathic Medical College and Hospital. Chairman, Board of Studies, Homeopathy, RGUHS, and NABH certified assessor. Likit, over to you.
So we welcome you to the session, sir.
Good evening, everyone. So, thank you, Hogar and Likit, for giving introduction about Jidnasa and myself. So, I think, can you hear me clearly?
Yes, sir, you are clear, sir.
Okay. So as a part of Jidnasa, they are conducting different seminars on different topics. So we are here with the homeopathic topic today, and in relation to the benefit for the students, we are students have been selected this topic regarding the homeopathic Medica. Being in this department for many years, and even as a student, every day we have to learn new things, and we have to upgrade ourselves regarding the subject. So being a student and also teacher of this subject, I had been come across many difficulties during my studentship, and also afterwards in post graduation, and also during different times of my teaching. So this is a process of evolution. It cannot be a single day achievement which we can do it. And I'm not a great scholar to remember all 4,000 odd remedies which are there in our homeopathic system of medicine. But the main thing we should always understand about homeopathic materia medica, and also as its reproduction in your exams. More than that, I would say the reproduction is required not only during exams, but its application part. So whenever we learn something with a purpose, means whenever we read a remedy with a purpose, not only writing in the exam, but how I can use that medicine to treat my patients. That is how you can generate your interest into that particular remedy. It will change your concept regarding reading of Materia Medica and memorizing the Materia Medica. Because reading will, whenever you have a concept of only reproduction in the exams to get a marks, then you will not remember it as useful for your future or during your practice. So whenever the purpose is mentioned clearly, the purpose for which you are studying, we take into consideration, then we can remember it for a longer time. So whenever we start with the remedy, and whatever remedy you start reading, always read with how I can use that particular remedy in what kind of patients, and how that patient will express this symptom or a sign or a modality or a mental general or a physical general, how it is represented in a patient in a clinic. So when we think in that way, when the conceptual understanding of that remedy will change. So always we tend to I tend to give an example of whenever we come across many of our friends, we'll be knowing about their names very easily, and their parents' name, probably few of them. And but will not be knowing their grandparents and their other cousins and other names, even they are very close friends of us. See, in likewise, whenever we are with the friends, we'll be knowing some of the details which are very necessary for us to day-to-day communication and understanding that person. Likewise, whenever we read a remedy, is not required or the whole history or a whole literature of that remedy to be memorized or kept in a mind. We should make a picture out of it and remember something out of that. Always there is a always everybody tells that Materia Medica cannot be remembered. It is highly volatile. Yes, it is highly volatile, because if we read all 40 or 50 remedies which are there for 1 year, if we study within 15 days, definitely it is going to be volatile. But whenever we try to revise it in different time periods, not only once, it should be revised whenever the memory is like, whenever you repeat it, there will be it will remain in your memory for a longer time. So that revision is required. And whenever you read a remedy, even if I read a remedy just now before this presentation also, I was reading some of the remedy which I used to read since 15-16 years. But whenever I read that same remedy now, every time when I read, there will be some different understanding of that remedy. Why I'm telling is,
Mic check.
hello. But because why I'm telling is, whenever we revise it, so there will be a new understanding about that remedy. So likewise, we need to read or revise frequently. So for that purpose, so always we know that when
Hello. Mic check.
yeah, can you see it?
Sir.
PPT is visible. Okay. So
No, sir. Hey.
can you hear me now?
No, sir.
Yes, sir.
Okay. Okay. So whenever we listen some song from any movie, we remember that whole song
Sir, you can unmute, sir. Your audio is not audible.
Yeah, now?
Yes, sir.
Okay. So whenever you hear a song from a movie, you remember whole that lyrics, right? So it's a long song, but everybody remember that complete lyrics. How it is possible? It is not possible for a remedy, but it is possible for that whole script to be remembered. Why? Because that all those songs will have different tunes. They will not be having a single tune. If all scripts, all lyrics will have a same tune, the person will not remember that particular song. So that's why whenever we read a remedy, we need to make a picture out of it. We have to put different tunes into that to understand and remember that remedy particularly. So likewise, when we remember particularly for particular things, those will help us to reproduce in exams. So I will begin with that, how we can write up or utilize those things into our mind and use better answers into the exams and also as well as in the clinics. Can you see this PPT now?
Yes, sir. It's visible, sir.
Okay. So can you see this picture?
Yes,
See,
sir.
when you see this picture, this picture contains actually two images. One may see a young lady and another person may see a old lady. Means whenever we see any image or any write-up, so whatever we are concentrating, that we will see. Means if we see a young lady here, we'll be concentrating on that. You will not see the old lady which is there with this nose, this mouth, and with this scarf. So this young lady and this old lady, both are there in the same picture. Likewise, every remedy will have its own peculiarities that should be read and kept into your mind. When unbiased way, when we see, we can see many things into those remedies. So that is what I wanted to clear at the beginning. So when we go with the syllabus of our university, we'll see that this is what there in your syllabus of Rajiv Gandhi Health Sciences. So this is a revised ordinance of 2019. There are remedies called as major remedies, and few are called as these appendix 2 are minor remedies. These major remedies should be studied under the headings of these must know, desirable know, and nice to know areas. Why it is important? Even application of it, and also while reading of this for the exam and as well as for clinical purpose, we need to know the must know areas. These are very important. All these are less important compared to this first area. So first of the things we should know what should be the sphere of action of each remedy, and then pathogenesis, the physical constitution, thermals, ailments means causations, mental generals characters, and under that particular symptoms under LSMC, location, sensation, modalities, and concomitants. So this part is the main area of concentration, and always we tend to memorize more with the common name, alkaloids, They are also important, but not in every remedy. Some are important. I will tell you how and how we can remember it. And also, all diathesis, temperament, and miasmatic background, these should not be by hearted or remembered with a remedy. These should be expressed through these symptoms which are expressed. How the temperament, sanguine temperament is expressed through the signs and symptoms, not as a sanguine with a one particular remedy. So we should evolve through that symptomatology into diathesis, temperament, and miasm, and not to be remembered as particularly whether that is that or this. Like sulfur for sora, we should not remember as sora. Sulfur is also having a syphilitic symptom. The prominent miasm is sora, but how that sora is expressed, that we should understand, not to by heart it. Okay, so going next to that, as I told, this template is about these major remedies. Okay, under minor remedies which are there, these are minor remedies which starts with this is only a small pick which is taken from that syllabus. It starts with one remedy and the focus area. It is mentioned as focus area. It is mentioned here, remedies shall be learned with the focus points given against respective remedies. Means these areas, these are the sphere of actions of these remedies, and that should be remembered very clearly. Like, for example, Actia spicata rheumatism. What kind of rheumatism or affections Actia spicata is having? The small joint affections is very characteristic of that. Then elaborate into location, sensation, modalities, and concomitants. Likewise, all other remedies, right? Agnus castus is a remedy for male and female genitals, and under male, what its peculiarity having it. So that we should study under minor remedies. These are minor remedies, and we should always have this localized understanding of those affections rather than all the things which are mentioned here under this must know area. So that is what should be remembered with particular thing. And the first major remedy, it will have a polycystic means indications. So that is why multiple system will be affected into them. So those will be studied differently. Okay. So going next to this, just a minute. Okay. So we know that in aphorism 3, it is mentioned that the knowledge of disease, the knowledge of medicine, and knowledge of application of medicinal knowledge to the disease knowledge. Why it is important means whether we study the remedies for exam or therapeutic purpose, means for the use in the clinical practice, always we should see that what is treatable in that medicine. Okay, so what is the sphere of it and what it has a capacity to cure or treat that particular remedy. So how we can know it is through the knowledge of disease. Suppose if I mention it is a pharyngitis. So under pharyngitis, what are the symptoms you get? The soreness of throat, roughness, irritation. Along with that, there is irritation at the soft palate and difficulty in swallowing. So all these, when we know that these are the expressions of pharyngitis, and if we know that which remedy will be useful in that through the signs and symptoms of that particular remedy picture, that application of that knowledge, both knowledge into the knowledge of disease, then we can make a cure. So for that, we will take example of each of them, each remedy which is asked in previous years. Okay, so if I take an example of can you see this? Can you able to see that? Is it visible?
Yes, sir. Yes, sir.
Okay. So this is a question paper of 2022. Okay. So 22, the Materia Medica. The third year, I think, third year BHMS. So if I take an example of this first question, okay. What it is asked, the mental generals, physical generals, gastric affections, and modalities. So this is having a 10 marks. So two questions are asked for the 10 marks. So last few years, if you see the question papers, it is very clear what to be answered in each question. Okay, it is not previously when we used to get the questions like give a drug picture of lycopodium. Under that, you will start writing from its head to toe everything about the lycopodium with a common name, source, everything. So, but that is not required. As I shown in the previous slide, the must-know areas of particular that major remedies should be concentrated, and what is asked, you start writing about that. When it is asked to describe means a particular thing, you have to explain it, right? So under this, there is no need of writing the common name, source, etc. This is very commonest practice the students make. It is not required. You are wasting your time and energy for this. What is asked, you write only that. They are asked about the mental general, physical general, gastric affections, and modalities. You only concentrate on that and start writing about that. I will show how we should start with that. Along with that, if I need to show you, suppose see here. In one case, it is asked about the lycopodium for 10 marks. In another year, the lycopodium is asked for only gastric affections for 5 marks. So again, here there is no need of writing all other things, the mentals, mental general, physical generals, and other modalities. Modalities, if they are related to gastric affection, well and good. The only gastric affections are asked, then you should concentrate more on that. How we should analyze it, how we should study them particularly, that we'll learn now. Yes. If you see here in this, I jot down some points. So whenever we start writing about the mental generals of Lycopodium, always we should make a picture of that particular person, how the Lycopodium persons will be. They are usually very what it is called as mentally they are very well, but physically they are weak. Means mentally they are highly intelligent, highly thoughtful, and but at the same time they have that this feeling of that superiority, haughtiness is very characteristic of that. But at the same time they have the lack of self-confidence. Means whenever they are going into the public, whenever they are expressing themselves, they have that lack of confidence. Because of that lack of confidence, they are always apprehensive about those things, appearing into new things or doing something new. So that is why aversion to undertake new things is very characteristic of that person. And this lead to this superiority complex or haughtiness will lead to these characteristics: avarice, greedy, misery, malicious, and this timidity is because of that apprehension to appear in public. Whenever they want to reproduce something, they will be very afraid. Even they are very proficient about the subject, they are very afraid to reproduce into the public. Like maybe a lawyer who always, every day he will be in the court, he will be producing many cases. But whenever his turn comes, he will be very timid to start with. But when they start, they will be very confident because they will be knowing many things. They are very intelligent and always think that they are top of everything. But whenever they want to start, they will have a difficulty. It is starting problem in those people. But when they start, they will be very easily, they can carry forward their works. So likewise, when we make a picture out of it from the same mental general, we can remember that person, Lycopodium person, as one picture and reproduce that into that particular characters. When you go for the physical generals, the physical general of Lycopodium is like they look very shallow look, and they look older than what they are. They are emaciated look. They are physically having normal muscular power, weak muscular power, but intellectually keen. As I told, mentally they are very strong, but on the physical side, they have emaciation or weak muscular power. So that is why it is also when physical generals are there, it is covered on the physical aspect, which are common with many of the complaints. Many of the complaints usually gradually developing functional, like functional power is weakening, failure of digestive power, and functions of liver is highly disturbed. So the weak digestion which is because of weak liver, which is a characteristic of this lycopodium. That is why this weakness lead to this malnutrition. And atonicity is again because of this. That is why the lycopodium is a great remedy in GIT affections where there is a weak digestion and also the liver troubles leading to accumulation of more flatulence. So that is why it's a more it is one of the trios of flatulence. Likewise, in the particulars, it is asked for a gastric complaints. As I told in the physical generals, it acts more on the liver, and that weak digestion leading to that flatulence and dyspepsia. And along with that, always the sensation of soreness, sore irritations is characteristic. And this weak liver is a cause for this sensation, as whenever the person eats little, they feel the fullness of the stomach and wakes up at night and feeling with the hungry. So if you remember, whenever we come across condition called as peptic ulcer, especially under duodenal ulcer, this waking up at night with a hungry sensation is very characteristic of that particular disease, right? And the gastritis with gastric ulcers is a characteristic of this weak digestion and this irritations. And wherever these condition diseases, so we know the disease knowledge and we know the medicinal knowledge and connect this into those particular conditions. Means the lycopodium is more indicated in peptic ulcers or a simple dyspepsia, what we call as hyperacidity, where the flatulence is very characteristic, then it is more indicated. I think you remember the trios of flatulent remedies. They are lycopodium, China, and carboage. Okay, so carboage is more with the upper abdomen, that is stomach is more affected. The China is whole abdomen, the lycopodium is lower abdomen. Means this flatulence accumulation is more prominently expressed in lower abdomen in lycopodium, whereas in China it is whole abdomen and carboage it is upper abdomen. So carboage is having more action over the stomach. So that is why we tend to get that indication into those affections. Means we are applying the aphorism 3, that this knowledge of medicine we are applying to knowledge of disease. When we remember not only this, but in relation to disorder where we get these characteristic affections in particular diseases, then we'll apply these remedies in those disorders very peculiarly. It is not in homeopathy, we will consider this characteristic local symptoms along with a characteristic mental and physical generals, right? So we know that it is a sphere of action, right? It is sphere of action. Sphere of action is on this stomach and abdomen, and what it leads to these characters. So it, because of its action over that, it is producing some symptoms, and that symptoms is indicative of particular disorder. So if we remember like this, we can reproduce them very prominently, and also we will remember them for a clinical practice very clearly. So the another point in that is modalities. So modality, very characteristic modality, everybody knows that it is 4 to 8 p.m. aggravation, and it is more on the right side or whenever there is a radiation from right to left, and amelioration by warm food or drink, and amelioration by motion or uncovering. So if we reproduce this particularly, which I mentioned as mental generals, physical generals, and gastric affections and modalities, this is enough to reproduce what is asked into that particular remedy, right? So going back to that particular question paper. So here what is asked? So mental generals, physical generals, gastric affections and modalities. You reproduce that, that is enough. And it is asked, what is asked, you write and you will get that particular marks for that. So suppose it is 10 marks. So 4 parts are asked. So out of this, it may get 3 and 3, 2, and 2 marks. So suppose if you divide like this, you will get a full mark if you write all those points clearly. And here it is not remembering for the exam purpose, but whole remedy should be remembered. Why it is asked? Mental general, physical generals, gastric, and modality. Usually the must know areas are asked in the exams to reproduce. The nice to know area or must know areas are very less. They are important in relation to that particular remedy, and those are asked very few cases, right? So likewise, if I want to reproduce you with a condition, another remedy, one example where I can give you. I think you have studied about the bromium, right? So if I tell you about bromium, it is a halogen, like with iodine, the bromium is a halogen. Okay, so if you see mainly where we'll read, that is also important. I forgot to inform you about the textbook also. I think everybody refers the Dubé, that is whether any teacher tells or nobody tells, that will be with you all people. The other books which I suggest all you to read is, one is Allen's Keynotes, Borik's Materia Medica, okay, Nash Therapeutics, Dictionary of Materia Medica, by Clark, and lectures, Kent's lectures. So these are the books which you should always read and make a picture out of it. Why I suggest you to read all these books and Dubé as last? Because when you see this Dubé, so in that it is a great book with a great collection of all the characteristic of all the remedies. But what happens is, when you see that presentation of remedies in that book, you will see that every remedy is given under the same all headings, similar headings, which are very confusing when you read 3-4 remedies. You will remember first remedy, second remedy. When you go for third and fourth, you will forget first and second, because it is all in the same type of expressions, right? As I told in the beginning, you remember a song with different tunes, with a long lyrics, right? Why? Because the tunes are different. If the tune is same, you cannot able to remember that. That is what happens when you read books like the Dubey, right? So this is a good reference book rather than the first book as itself. So always, as I told, the remembrance should be based upon aphorism 3, that is disease of knowledge, uh, knowledge of disease, knowledge of medicine, and knowledge of application of this medicinal knowledge to the disease knowledge. So we will study the diseases, right? From the anatomy, physiology, we know that normal functioning, pathology, through that we know the abnormalities. Through surgery and OBG, we know different disorders related to that particular conditions or particular systems, and through that we understand those diseases based upon the clinical features, signs and symptoms. Unless we match that particular signs and symptoms which we learned from the proper side and apply into our medicinal knowledge, we cannot able to reproduce or remember it for longer time. That is how, suppose if I mention, if I suppose if I show this bromium, right? So this is from Allen's note, right? This bromium is from Allen's note. See, if you see these red lines, red words or with italics, it will be in your book as italics. Okay, so these are the main areas of its indication. Means its action is more on the respiratory system with diphtheric conditions or CROP. CROP is nothing but upper respiratory tract affections or inflammations of upper respiratory tract, or it is also called as pharyngolaryngotracheitis, which is a old word is CROP, right? And diphtheria is another area where the bromium is indicated. What is the peculiarity of this remedy in diphtheria? It is the membrane forms in pharynx, begins in bronchi, trachea, and larynx, and extend upwards. Sorry, begins in bronchi, trachea, and larynx, then going upwards. Means upward formation of diphtheria is very characteristic. Means what? Whenever the person starts in the diphtheria affections, they starts in the trachea first, then the larynx, trachea, larynx, and then it comes to the pharynx. So below upward movement is very characteristic of bromium. We know the diphtheria what happens. We know the CROP in that what it happens. In CROP, it is upper respiratory affections with, it is also having the much rattling of mucus. Mucus is, there is a large collection of mucus where, just I will show you. Much rattling of mucus during cough, but no choking. If there is a choking sensation, it is HEPAR-sulf. If it is not having choking sensation, but there is a much rattling sensation of during coughing, then it is bromium. Okay, but no expectoration. It is like Antimonium tartaricum. Antim tart is also having great rattling sound, but not able to expectorate easily. So in that way, it is more important to understand where exactly it acts. So we know that it is acting, we know the disease, knowledge of disease, that what is diphtheria, what is CROP or pharyngo-laryngeotracheitis. And this knowledge we are applying here. But here, what is the important thing in bromium to be remembered is that the persons will be more of a light hair, light eyebrows, very delicate, fair skin. If those people are affected with these respiratory affection, then it is more indicated. It doesn't mean that it cannot be given in a darker skinned people. But if they are there, along with that, it is more indicated. So second characteristic is what? If it is not available, the second characteristic is what? Again, there is a dyspnea, which is very prominently aggravated at seashore. Means whenever the person is coming towards the seashore after sailing into the sea, when there is an affection of sensation of breathlessness, then it is more indicated in those conditions. Okay, if you see this boric, okay, in always this part is very more important, and always you should read this part. Means this is a whole gist of that indication of bromium for which it is used. As it is mentioned, the first word is only, it is having most marked effect on respiratory symptoms, especially larynx and trachea, right? So this is the sphere of action what we are talking about, which is there a must know area in your syllabus. So bromium is having on the respiratory system, that to what? Larynx and trachea. So it is more in the tendency of spasmodic attacks with the breathlessness, sense of suffocation, complaint being overheated. When they are chilled with the overheated, then it is more indicated. And along with that, there is a glandular affections which are hard and seldom go to the suppuration. Glands, whichever gland, it may be a tonsil. Okay, so whenever there is respiratory affection with larynx and trachea with tonsillitis, as it is mentioned here also, tonsillar pains with swelling, red, deep red, in those affections, tonsillitis with laryngitis or tracheitis, then it is the bromium is indicated. So what we should remember in this is mainly its sphere of action, where respiration. So under that, larynx and trachea. Okay. So likewise, you should understand each remedy. This is a picture given from another book called as Clinical Farrington. So this is one more book which, after reading other books, a clinical orientation of that remedy will be clearly understood by this book. So if I go further with that, I hope you are understanding how you should reproduce them and how we should remember those remedies peculiarly. Okay. So one more point into that is about reading a therapeutics. Okay. Therapeutics is also we should remember through this knowledge of disease, knowledge of medicine, and application of this medicinal knowledge to the disease knowledge. Through this only we can understand how remedies can be made. Suppose if I take example in therapeutics, whether it is surgery therapeutics, gynec therapeutics, means OBG, or medicine therapeutics. Whenever we make a therapeutics should not be in a reverse order of remedies fitting into some conditions. We should know the condition, their clinical features, and that different classification, causes, everything, and we have to match that similarity, the disease similarity, with remedial similarity. Okay. I will take an example of urinary tract infections, right? So we'll create a therapeutics, the remedies for this condition. Okay. So under urinary tract affections, if you go and check this Harrison, for example. Okay. So here the definition is given as it encompasses various clinical entities. One is cystitis, one is pyelonephritis, prostatitis, and asymptomatic bacteriuria. It is not a one condition, but it is a multiple condition which is commonly known as urinary tract infections or inflammations. So cystitis, you know that it is a bladder inflammation. Pyelonephritis is a involvement of issues of kidney, and prostatitis is about prostate, and asymptomatic bacteriuria is a simple UTI where there may be a very mild or no symptoms, but accidentally when the person goes for the urinary examination, they get some positive in urine routines, right? So in asymptomatic bacteria, there may be no local or systemic symptom. In cystitis, there might be dysuria, increased urinary frequency with urgency, nocturia, hesitancy, and suprapubic discomfort. Whereas in pyelonephritis, there will be a fever, low back pain, costovertebral or angle pain with nausea and vomiting. So whenever this pyelonephritis is there, there will be more fever, and the location of pain is more on the backside, radiating downwards and front. So this is a disease knowledge, right? We know the UTI will represent into these different kinds. Now, through this, we'll make a remedies into it, right? How? Just a minute. Yeah. So we have to divide them into lower UTI or upper UTI. Lower means from bladder downwards, and bladder upwards is upper UTI. So what is the character in lower UTI? Dysuria is common in both. Urgency is common in both. Maybe in severity it will be different. Here it is a localized lower abdominal pain, but in upper UTI it is a flank, back, or groin pain with nausea. And there is always low grade fever in lower UTI, and here it is more fever in upper UTI, right? So this is fever with chills and extreme fatigue, right? So this makes we divided into lower and upper UTI, right? Now we'll see the remedies which are having all the remedies which are having urinary tract affections will have a dysuria, urgency, a common, right? But where the pain is, when the pain is, and what is the associated with the pain, whether the fever is low grade or high grade with a chills and extreme fatigue, that makes the remedy different. And if along with that the prostatic affections are there, there is a different expression along with that. So that we should need to understand. Okay. Okay. So I will come to here. So we know that there are remedies which are acting on the urinary tract, genitourinary. tract. One is Berberis, Sarsaparilla, Turbentina, Cantheris, Pereira breva, Equisetum, according to the year which you belongs. Okay, some may be in second year, some may be in third year, some may be in final year. But at least one out of this you have studied in your each year, right? So if you see that Berberis will have more action on the kidneys and bladder, Sarsaparilla is more on the bladder, Turbentina whole urinary tract, Cantheris is again whole, Pereira breva is more on the ureter and down bladder, and Equisetum is on the bladder. Means where exactly, whether it is upper or lower, it depends upon the previous disease picture which we saw here, right? So whether it is lower or upper, depending upon that, we have divided these remedies into lower or upper urinary tract affections, right? So when we remember like this, it is more easy to understand them. Next important thing is we know where it is, whether it is lower urinary tract or upper urinary tract. Next is what? Next is the sensations, with or without pain. Means with pain, what is the sensation? And when the pain is, when it is more, aggravation and amelioration, whether it is during micturition or after micturition or at the conclusion of urination, that makes different affection. Suppose the person is having the pain at the conclusion of urination. What happens? We should know the process of normal micturition. Means whenever there is widening of urination, the internal sphincter at the bladder will release and the urine flows out into the urethra and urine is taken out. At the conclusion, there is a spasm or closure of that sphincter. When there is a closure at the closing of urination, there is severe pain at the conclusion. Means there is inflammation along the bladder which irritates more when there is a closure of internal sphincter of that bladder. So that sphincter pain will lead to severe pain at the conclusion of urination. That is where it is more indicated in Sarsaparilla, or it is more indicated in Equisetum, or it is more indicated also in case of Cantheris, right? So urethra is, suppose along with pain, there is pain in the perineum. Along with this, during micturition, pain in the perineum is because of involvement of prostate. Membranourethric part affection will lead to indication for prostate, and here the remedies like Equisetum will help into those conditions. Okay, so likewise, suppose if I give another example of remedies for sleep disorder. Whenever we come across the remedies for sleeplessness, there are a lot of remedies come to our mind, right? So it will be with simple as Naxomica, with Passiflora, or even Hyoscyamus, Coffea, right? Stramonium. These are all remedies for sleeplessness. But whenever we make a therapeutics, we should know the picture of sleep disorder. How the sleep disorders are understood. Whenever we come across any sleep disorder in a patient, we should ask about whether there is a difficulty in initiating of the sleep when they go for the sleep or maintaining of the sleep at the night. So if it is affected, we term it as insomnia. Whether this sleeplessness is because of excessive daytime sleepiness or tiredness, whether it has unusual behaviors during sleep, like they are called as parasno. Means some people talk during sleep, some people walk during sleep, some people suddenly get up at night with uh, some dreams or some sensation. So these unusual behaviors will have the remedies differently. Only difficulty in initiating sleep and maintaining sleep is remedy will be different. Excessive sleepiness during daytime and no sleep at night, the remedies are different. For this is different. Okay. So we'll take another 10 minutes, 5 minutes, 5 to 10 minutes to conclude it. Okay. So when we go ahead with that remedies, you can concentrate here, sleeplessness remedies. Okay. This is sleeplessness due to anxiety. Arsenic cocculus having 3 mark and causticum is having 2 mark. Okay. I will just scroll it up. Suppose the sleeplessness is because of dark room. The one of the most characteristic remedies, stramonium. Means when the room is dark, they cannot get the sleep. That is stramonium. Suppose the sleeplessness is because of excitement. They are highly excited. Maybe a good thing or bad thing. If that is there, the most common remedy is coffea. The second is hyoscyamus. Third is naxomica. For every sleeplessness, the remedy will not be a single, right? So with the cause, as I told, the disease as a sleeplessness, we understand under these headings, right? So under same headings, we should differentiate the remedies as well. Okay. When the sleeplessness is from the grief, natrum mur is more indicated than any other. Sleeplessness is because of homesickness. It is capsicum. Again, the capsicum is very characteristic of homesickness. Yes. Also with the excitement also and mental strain also. Both the naxomica is indicated, right? Suppose if it is again excitement and exertion after, the hyoscyamus is more indicated in both the conditions. If that two characters are there in a single person, then that is more indicated, right? So likewise, if the sleeplessness, if you see in old people peculiarly, the Baraita carb is most prominent. Means we have to create the therapeutic according to the clinical presentations, not as one particular remedy and putting that into those socks. So also with the sleeplessness with sleepiness, means during daytime it is more sleepy and night sleeplessness. So many remedies you will get: belladonna, chamomilla, chelidonium, opium, phosphorus, pulsatilla, sepia. Okay. So likewise, another one, because of thoughts in the mind, always multiple thoughts, that is coffea, naxomica, pulsatilla, calcarea, arsenic. These are the very peculiar characters. Suppose if you go with the naxomica and see all the, this is a repertory reference. Okay, so if you see the rubrics in all these, wherever the Naxomica is mentioned, the whole character of Naxomica in sleep disorder you can reproduce. Likewise, sleepy all the day, sleepless all the night, and body ache all over. The best remedy is Staphysagria, not Naxomica. So Staphysagria will act more prominently in those characters, right? So likewise, when we create therapeutics, we should understand the knowledge of disease, then we create those remedies. I will give one more example of this last example for how we can create the therapeutics. For peptic ulcers, we know that anacardium is a remedy for GI affections and also a peculiar mind. What is the character of mind? The duality. They are, because of this duality, they are not able to judge easily. Because of they cannot able to judge, they will have a more stress, strain, and this strain, stress, and dual mind will lead to affections of duodenal ulcers. Why I mentioned is anacardium is a remedy where abdominal pain is relieved by eating. Whenever they are empty, they are aggravated. Aggravation during empty stomach is an indicative of duodenal ulcer, what you learn from your surgery, right? That is more a very prominent expression. Why? After 3 to 4 hours of eating, or in between two eating, means when it comes to duodenum, the pain is more. Or whenever the stomach is empty and food is going through the colon, then the duodenal ulcer will be more affected. And aggravation night, pain in the abdomen, epigastric pain, aggravation at the night is also indicative of this anacardium, right? So anacardium is more indicated in duodenal ulcer under peptic ulcers than any other remedy. Likewise, you create all other picture of each remedy. Suppose if you see this Kali bichromicum, right? So Kali bichromicum is also a remedy for ulcers, particularly stomach. So in gastric ulcer, it is more prominent. Likewise, the carboids, likewise hydrostasis, graphitis, phosphorus, all are more with the gastric ulcers. And here they are more with the duodenal ulcers. If you see that again, as I told, anacardium, argentum nitricum, they have anxiety, the mind character. So that anxiety will lead it to sense of weakness at the epigastrium. Naxomica, hurried behavior with irritability. Lycopodium, as I told just in the first slide, that is on the mental aspect and physical aspect. So all these will lead into duodenal ulcer. So likewise, if we create the therapeutics based upon the knowledge of disease, that makes more crisp understanding about those conditions as well as those remedies. So when we make that particular things very clearly, then we can understand what to be understood in each remedy. As I told, so this part of sphere of action, thermals, element causations, and characteristic symptoms under location, sensation, modalities, and concomitant should be remembered. and they should be reproduced exactly what it is asked, not as you know, right? So, for example, this is one question paper where there is a mentals of anacadem is asked. As I told, so only mental mind characters of anacadem should be reproduced or should be explained. How the dual mind of anacadem is expressed. So this dual mind will lead into different peculiar mental disorders. So where it is more indicated. Okay. So anacadem is indicated in those mental disorders. So likewise, I will show one more example. Suppose a 3 marker is asked here as a nasal affections of aurum trifolium. So aurum trifolium is more indicated for acrid discharges. So acridity should be mentioned whenever you mention the aurum trifolium. And in nasal affection, this acrid discharge will leads to cracks, redness, burning of nose and nasal mucosa. Along with, because of this acridity, the tongue is also inflamed. Because of that redness of the tongue, it is called as strawberry tongue. Why? It is red, swollen, and all the papillae are inflamed and enlarged. So when you mentioned only about it, nasal affections, along with why the tongue is taken, because this acrid character is also with the tongue. When along with the nasal affection, the tongue is strawberry like or red, then it is more indicated in aurum trifolium. Likewise, each remedy should be understood. For example, here it is asked for Berberis vulgaris. As I told, so whenever it is asked about urinary affections, then what we should remember is, first is whether it is lower or upper urinary tract, and under that, what are the characters it is having, more with the affections of kidney and bladder. So that we should explain in the Berberis. Okay. So if I show you one example of that, would be in the Sarsaparilla. Okay. So any questions or any doubts or anything to be asked, you can just put into chat box, and we can have a discussion, and we can close with the giving of some examples into that. I hope you got my points regarding how to read those remedies, how to reproduce, how to remember, and how it should be used in the clinical practice. Any questions, discussions?
Sir, there is one question from the participant.
Yes.
His question is, discuss indications of creosote and natrum acid in pelvic inflammatory diseases. So should we write about the drug first and then the indicated disease condition, or should we write entire drug?
No. Can you repeat me again?
Discuss indication of creosote and nitricum acid in pelvic inflammatory disease is his question, sir.
Nitric acid, I think.
Yes, sir, nitric acid in pelvic inflammatory diseases.
Okay.
And he's asking, should we write about those two drugs first and then about pelvic inflammatory disease, or should we write directly about only pelvic inflammatory disease condition?
Okay. First, I will take that what you are talking about, the creosote, right?
Yes, sir.
Okay. So whenever we go ahead with a pelvic inflammatory disease, we know what is pelvic inflammatory disease, what is its clinical presentation, and what are the different kinds of expression of pelvic inflammatory disease, right? So accordingly, there is no need of giving all the expressions of creosote into that. So suppose the creosote is mentioned, I will show it. Okay. Okay. So here under this is boric materia medica. Okay. So creosote, if you see, as I told in the beginning, so this part in boric is the most prominent part. So what it is mentioned here, it is having excoriating, burning, offensive discharges, which is very a characteristic expression of creosote. Okay. So along with that, there are so many indications about creosote is having indication or affections of toothache, right? Dentitional affections. It has a indication in stomach disorders, abdominal affections. Okay. So all others are not important when it is asked for pelvic inflammatory diseases. So here the discharge which is mentioned at the top, right? Excoriating, burning, offensive discharge, and hemorrhage and ulcerations. Just a minute. This part. And one more is here, right? So these are to be reproduced and given importance, like female affections wherever menses are too early, prolonged, along with that intermittent. Okay, if this is a character of menses, and along with that, during that the pains and discharges are acrid, greenish, then it is more important. So this should be expressed with corrosiveness, burning sensation, corrosiveness. That is the character of the creosote. So only this part should be explained, not all other like abdominal or other indications of creosote. Got the point?
Yes, sir.
One more best this one book when you read therapeutics is Leaders in Homeopathic Therapeutics by E.B. Nash. Okay, if I take example from this only, okay, I will go for where it is creosote, right? Creosote. See here. remedies for tendency for hemorrhage. Hemorrhage occurs with leukorrheal troubles, which are intermittent with lochia or confinement. Ulcerations of uterus, ulcerations which are found in cancer of uterus. Burning in pelvis, like a red hot coal, and discharge of clot with foul smelling blood. So this is how he explains about a PID. Okay. So through that, elaborate from the this Boric or from Allen's keynote or any other, even Dubé, where it is mentioned. So this is a clinical expression how it can be recognized in HOSUR. Right? Okay. Any other remedy or question?
Sir, is it necessary to compare and write remedies in the exam when they have asked about trios of remedies?
Yes, yes. Trios means all three remedies should be explained.
It's not like that, sir. If now they've asked about carbo wedge, write about some point about carbo wedge they've asked, and that and it.
Okay. Suppose carbohydrate is asked for GIT affections. Okay. Shall I take that?
Yes, sir. You can take, sir. You have time.
Yeah. Suppose if it is asked and if you want to write that, you write about what is the character of carbohydrate. Again, it is a flatulency, burning sensation, okay, aggravation after eating, heaviness or heavy feeling at the epigastric region after eating. Okay. Along with that, you can mention it's a trios for flatulency and especially in the upper abdomen, along with the remedies. There is no need of comparing and contrasting it again with China and Lycopodium. As I told, China is for whole stomach and Lycopodium for the lower abdomen, the whole abdomen. So what is the need is mainly concentrate on carbo veg, and whatever it is eaten, it is fermented out. So that is the character of that carbo veg. That only you have to concentrate. Other part, just mention it. There is no need of explaining those other remedies of trials. Hope you got that point.
Yes, sir.
Okay. Any other question?
No question, sir.
Okay. So thank you very much for all the participants who are there for this seminar, online seminar. So it was the first attempt. We started with Jidnasa and hope we'll continue with the more similar
Yes,
kind
sir.
of sessions in
Yes, sir.
future days.
Yes, sir.
So if you have particular areas which you want difficulty to understand, okay, you can just mention me and I will try to get the proper resource person to clear that doubts and to understand more clearly about the particular topic.
Yes, sir. Now I would like to request Rahul to give the vote of thanks.
Yes, Likitji. So now we are at the end of the session. I wish all our audience are now clear with the Materia Medica answers accurately, and they are well versed with the topics whatever have been explained by the Dr. Anand HOSUR sir. So they are now can write the exams. Now they can write the present their proper answer properly in the university exams. and also with the study of homeopathic therapeutics. I would first like to thank our speaker, Dr. Anand J. Hosur sir, for sharing their knowledge and making this session wonderful. And I would thank technical team of Youth for Seva for providing technical assistance for this session. I would also thank our national convener, co-convener, Jignasa Karnataka State team for organizing this wonderful session. Last but not the least, I thank my dear friends, teaching faculty of various colleges, and audience who are watching this session on YouTube and also on the Zoom link. Thank you all and have a good day. Thank you, sir.
Thank you. Thank you very much.
Thank you, sir. There is a quote on homeopathy from from third year students. It's changing me day by day. I have a strong belief, come what may. Homeopathy is here to stay. I cry and I laugh and weep sometimes. Practicing classical in these modern times, finding a remedy may be a pain, but all this never goes in a vain. In some others, a lyco and a sulfur in others, a Steffi in quiet and a smiling mother. Then there is aconite for the tremendous fear, and arsenic will reveal when death is near. I am not the same as I now categorize, and I no longer the 20-minute conversation materialize. I want to know the stories involved, the riddles of the remedy still unsolved, what's with the chilly calcarea and angry nuts, the legacies who cannot wear a tux. It's changing the way I look at things, oh the wonder and the joy it brings. Hope for the future when there is none. This is just a start and I am so not done.
Nice one.